Hello everybody, welcome to Just Upright. My name is Doc Jing Ruder. I'm a doctor of physical therapy and I'm a certified dementia practitioner. If you are new to my channel, welcome. Thank you for watching. If you are a subscriber, thank you for your support. And if those of you who haven't subscribed yet, please hit the subscribe button. Your support means so much to me and my team. Thank you so much. We also have justuprighttherapy.com website where you can see our services. I provide consultation to patients and their family for physical therapy in order for older adults to be safe at home, to decrease their fall risk, and to improve their quality of life living independently in their house. So I also teach one-on-one coaching for foreign trained or new graduate of physical therapists on how to do documentation, how to improve your clinical decision making in order to give best care to the population that we serve. Also, please check out my books available at amazon.com. The links are down below. So I have books for foreign trained physical therapists on step-by-step procedure on how to apply here as physical therapists in the US. This book, Practical Tips for Therapists Prior to Migrating or Starting Their US Practice. So this is full of wisdom, advice before you dive into the therapy world in order for you to be personally, emotionally, psychologically prepared in the rehabilitation. Just Upright book. Okay, so practical tips to improve posture, balance, and decrease fall risk. So I discuss about here what is fall, what are the risk factors for fall, what are simple exercises that you can do, practical exercises that you can do in your house to incorporate in your daily routine to improve your posture so that you are more steady and you decrease your risk of falling. And for clinicians, I have Clinician Corner here, evidence-based information that will be important for your clinical practice, and also the standardized tests, simple and easy standardized tests. Some of it are recommended by CDC that we can incorporate in our documentation. So, and watch out for the upcoming courses and book that I'm going to release in the near future. Okay, so right now I'm going to discuss the part 2 of sciatica relief or relief from sciatica. If you haven't watched my video, my first one, I'm going to put the link here. And that is, I discussed in that video the flossing technique. Before I discuss the tensioner, I will just give a brief summary of what we discussed before. So for those who are just watching this video right now, so that you will have an idea of what I'm talking about or what I discussed from the previous video. But it is very important for you to remember that the flossing or the gliders that I discussed in that video is during acute attack of sciatica. If it is really painful, it bothers you a lot, the exercise or the technique that I'm going to discuss today is better if you don't have that much pain. Okay, it's a little bit achy, it's a little bit burning, tingling, but it's not super painful. You know, it's not 8 out of 10, 9 out of 10, 10 out of 10. Okay, so this is like for chronic sciatica. Okay, so we're going to discuss that, but let's have the review first. Okay, so back pain, sciatica relief. Okay, disclaimer, this information contained herein should not be used as a substitute for the advice of an appropriately qualified and licensed physician or other healthcare provider. The information provided here is for informational purposes only. Please consult your doctor for advice if any of the exercises presented in this video will be safe for you. The content producer will not be responsible for any personal injury, death, or property damage. Okay, so let's proceed. Okay, so as I discussed previously, the sciatic nerve is the largest nerve of the body. Okay, it came from the nerve roots L4, L5, S1, S2, S3 from your low back. So the nerve roots coming from the spinal cord came out from the back in between the vertebral bone, and they come together, gather together, and form this big sciatic nerve. So as you can see here in this picture, so it's L4, L5, S1, S2, S3, big chunk of nerve roots coming together forming the sciatic nerve. Okay, so this is usually where our nerves get impinged between the vertebral bodies or the spinal bones. Okay, but they can also be impinged here under the piriformis muscle. So if you have tightness or spasm of the piriformis, it can cause sciatica. Okay, and go down. Then your sciatic nerve will actually be divided into the tibial nerve and the common fibular or common peroneal nerve, also called common peroneal. So the tibial nerve will go to the back of your leg. So the tibial nerve will go to the back of your leg, down to the bottom of your foot. It will supply the muscles there and the sensation. The common peroneal nerve will actually go to the front part of your lower leg and the side part of your lower leg, up to the top of your foot for the sensation, and it will supply the muscles on those areas as well. So depending on where is the impingement of the nerve, it will specifically here in the low back, the presentation is different from one patient to another. Okay, so sciatica here, the most common cause of sciatica is disc herniation or slip disc or bulging disc. So as you can see here from the top view, this is your disc, this is the vertebral body, the spinal bone. Top view, there's an IV disc or intervertebral disc that we call, and if it is bulging, it causes pressure and impingement to your nerve root over here. So side view, you can see that here too. Okay, so for the purpose of presentation today, I'm going to use this research study by Hightam and colleague. They actually studied the difference between neurodynamic mobilization, which is the gliders or the flossing technique, and the tensioners technique that I'm going to discuss today, versus stretching exercises for chronic discogenic sciatica. Okay, and in this study, they find out that the flossing and tensioner technique, moving, gliding, and tensing the nerve is more effective in chronic sciatica compared to stretching the muscles of the legs. Okay, that's what the research study found out. Okay, this is very recent, September 2021. Okay, so just a review. Okay, so low back pain is one of the most common cause of disability in many countries. Okay, sciatica signs and symptoms include pain, numbness, muscle weakness, and limitations of moving or controlling the legs due to compression or irritation of the sciatic nerve. So symptoms are usually found in the low back, buttocks, and several dermatomes of the leg and foot. Dermatomes is just the map of where the nerve root is supplying the skin, the sensation of our body. So sciatica varies greatly from 1.6 to 43%, depending on what study you use. Sciatica affects more females than males. This is more common among people with sedentary lifestyle than the active people, and it may appear either suddenly you're doing something and you injure your back, or gradually, and in most cases it affects just one side of the body. Okay, so the most common cause of sciatica is disc bulge or herniation, lumbar canal stenosis, meaning where your spinal cord is located in the middle of your vertebra or spinal column. It's narrowing, so it impinges your spinal cord. Spondylolisthesis is like the sliding of one spinal bone or vertebral bone over the other. Trauma, piriformis syndrome, tumors, and obesity. Okay, so most common cause is herniated disc. Okay, so the pain can be increased with coughing, sneezing, straining, or other forms of Valsalva maneuver. Okay, Valsalva is like you're holding your breath while you're exerting your effort. You know, like lifting something heavy, and instead of exhaling, you're holding your breath. That's Valsalva maneuver. Okay, so tensioners, this is comparing it to gliders. Tensioners, on the other hand, are more aggressive but can have beneficial effects via a pumping action of the nerve. This may reduce intraneural pressure and improve circulation. So this is another study that was done pertaining about to the tensioners. Okay. So we're going to discuss the starting position. So this is the starting position and this is the end position, okay? This is the description based on this research study. In a slump position, the patient sits at the edge of the plinth with the thighs parallel, okay, to each other, arms crossing behind the back, asking the patient to move actively and conversely from a position of neck extension, trunk extension, knee flexion, and plantar flexion. So plantar flexion, your toes are pointed down, okay? So this is the starting position, okay? To a position of neck and trunk flexion. So you're gonna bend your neck and your trunk. You're gonna extend your knee and you're gonna dorsiflex or point your toes going to your knees, okay? So this is the end position, okay? So the gliders is opposite to this, okay? This is the tensioner. So I just want to reiterate that the tensioner, this kind of technique is not for acute exacerbation or acute attack of sciatica. If it is really painful, you can barely put weight on your leg, it really bothers you a lot, do not do this technique. This is for chronic, you don't have that much pain, but it is there. You can feel it, but it's not killing you, okay? Chronic phase of the condition. So I would say that the gliders will be for acute phase, so to calm down the nerve. But the tensioner, this is just like you're toughening up the nerve, okay? Making it more desensitized so that it's the exacerbation of sciatica or the attack of sciatica will be lessened, okay? So let's watch how we're going to do this in real life movement. From the starting position, move to the second position or the end position. From neck extension to neck flexion, back extension to back flexion, from knee bent to knee straight, and from plantar flexion to dorsiflexion. So just remember, this is the first position, this is the end position. First position. Okay, so you can do this 10 times. First set, 15 times. Second set, 20 times. Third set, and you have to remember at the end you have to hold it for 5 seconds, end position, and then release and relax. Okay, so again, in this research study, they did it 3 sets, okay, and with 5 minutes in between sets. So in the first set is 10 repetitions, and then 5 minutes rest, then 15 repetitions, 5 minutes rest, and then 20 repetitions, 5 minutes rest. So 3 sets, okay? So you can do this twice a day, 3 times a week. So if you make this is like a maintenance for sciatica, so that you will decrease the risk of exacerbation, okay? So I hope that this video is helpful. Follow us also on our Facebook page, Just Upright Therapy. We also have Instagram, justuprighttherapy.us, and we also have TikTok, justupright.us. Thank you so much, guys, for watching. I hope you would share this video to the people you know who are suffering from sciatica, and I hope they will find relief from this video or the other video that I already made. I'm going to make more videos about sciatica. There are more techniques there that we can utilize to help decrease the pain and suffering of our friends and family and loved ones and people we know. Thank you so much for watching. I'll see you in my next video. For now, stay blessed. Thank you so much for watching. Please do not forget to hit the subscribe button below to be updated with the latest video releases. Share this channel to other people you know who will benefit from just upright videos. Thank you again and stay blessed.